Good afternoon and welcome to the launch of VCOSS's Feeling the Heat report. My name is Emma King. I'm the CEO of the Victorian Council of Social Service, and it's my absolute pleasure to welcome you here today and thank you for joining us. I'd like to begin by acknowledging the traditional owners of the land. Where I am, that's the Wurundjeri people of the Kulin Nation, and I'd like to pay my respects to their elders past, present and emerging, and of course to any other Aboriginal and Torres Strait Islander people who are with us today. I would also like to acknowledge that sovereignty has never been ceded. It feels odd to be talking about extreme heat at the very beginning of winter, but there you go, that's the challenge of living in Victoria. Our weather switches between extremes, like extreme bushfires, floods and droughts. And I know that you might be freezing now, but in a few months' time, the community sector is going to be bracing itself for months of summer to come, and the heat waves that brings, because we all know that heat waves can kill. Heat kills more Australians than any other form of natural disaster, but in many ways it is absolutely hidden. People tended to say, yep, Australia is hot. And you turn on the news during a heat wave and you tend to be flooded with images of people down by the beach enjoying themselves, and images, I guess, of fun and frivolity. And that's because many of us are fortunate. A hot day might mean sitting in a cool office or sitting at home with the aircon kind of blasting through. We might take our family to a local pool or catch a movie at a local cinema. But the real story, the hidden story, is that for thousands of Victorian households, they suffer quietly when temperatures skyrocket. Extreme heat is not fun and games. Heat waves are sickness and they are bill stress. People might not be able to afford air conditioning and they work outside in the elements. They might have to swelter inside a hot home that's got no insulation or avoid leaving the house because they simply don't own a car. And while they might be extremely sensitive to heat because they've got health or a disability, a condition that worsens on a hot day. So that's why this report is about people. It's not about the impact of extreme heat on infrastructure or the economy. It's about how heat waves affect our well-being and how they exacerbate inequality. Our policy advisor, Ben, who I have to give an absolute shout out to because he's done a tremendous job on this report, is going to speak soon about some of the findings in this report, but I do want to spend just a moment talking about the community sector and the amazing work that the community sector does in this space. It is rare for our sector to be funded for work that specifically addresses heat, yet so many of the organisations that we spoke with during this report just are so proactive on hot days and in the lead up to summer. So for example, Bendigo Community Health Services, a fantastic member of VCOSS, and we're very close work with refugee communities in their local areas. Rural staff design translated resources about keeping cool during heat waves, and they communicate this through every channel imaginable. They train local champions about emergency management who spread that information far and wide amongst their local community and do the most fantastic job. And then there's a Ready Recovery Communities whose Ready to Go program pairs volunteers with people who are at risk during heat waves. The volunteers check in with the days, including transporting them to cool places for the day to help their health and well-being. I could go on, but the bottom line is that the community sector steps up on hot days and helps countless Victorians protect themselves from the heat. And they do this for the good of their community. It's why the sector features so heavily in so many of the report's recommendations. We think that community sector organisations should be funded to help people cope with the heat, and that their offices should be upgraded so that the staff that they have and clients can benefit from cool and appropriate environments and conditions. We also think that there's a role for our sector to play in being able to provide heat refuges and designing health information that is accessible and practical for every single Victorian. Today, we're going to hear from some of the organisations who are already doing this work already. CoHealth, Enliven and IPC Health will join us for a panel discussion about how they're tackling extreme heat in their communities. And we'll hear from the Department of Environment, Land, Water and Planning, or DELP, about some of their recent work on heat waves and climate change. Between each session, we're also going to be showing you videos of interviews with Victorians from around the state about their personal experiences of heat waves. But first of all, I'm going to hand to our policy advisor, Ben, who, as I said earlier, has done an incredible job of this report, and he's going to speak to you about some of the report's findings. It's my pleasure to hand over to Ben. Thank you.
Thanks so much, Emma, and a big thank you as well to everyone attending today. So, as Emma mentioned, climate equity at VCOSS, and I'd have to say extreme heat is by far the most common issue raised by our members and the community sector when we ask them about climate change. Personally, I think it's because heat is a tangible impact that affects Victorians every single summer, and we can already see how climate change is making it worse. Heat also directly affects the community sector and its clients, and it's people experiencing disadvantage who are harmed the most. And so when we came to developing a research proposal, extreme heat was the obvious choice. And we decided to do three things with this research. We wanted to break down the impacts of extreme heat, analyse which Victorians are most vulnerable to heat and why, and then address these issues through a series of policy recommendations. And we did this by reading the research that's already out there. We hosted a consultation with community organisations. We surveyed the sector about the impacts they see. And we also interviewed 8 people from across Victoria about their personal experiences on hot days. We filmed these interviews with help from Samurai AV, and we'll be presenting 3 of them throughout today's session. But firstly, in terms of impacts, we found direct issues like physical sickness, mental illness, and even death in the most severe cases. And there were plenty of flow-on effects like social isolation from being stuck at home or family violence from being cooped up inside with the perpetrator. But our research shows that protecting your health isn't an easy proposition for people experiencing disadvantage. If you can't sleep at night because your house is too hot, you might get sick from the heat or have to skip work the next day because of fatigue. And you can turn on the air conditioner, but that can cause financial hardship when your energy bill spikes. And some people sleep outside in the garden where it's cooler, despite the risk to their personal safety. Basically, it creates a lose-lose situation, and it's forcing people to decide between the least worst danger on hot days. For instance, would you rather risk heat-related illness or have less money to spend on food and rent? It's a choice that nobody should have to make, but every summer there are Victorians who have to. Then secondly, the next part of the report drills down into the things that make people vulnerable to heat. It asks who's more vulnerable to heat and why that's the case. We took a close look at income, housing, location, age, disability, cultural and linguistic diversity, employment, gender, and health, and thought about how these things can put people at risk during heat waves. For example, in regards to income, having less money obviously means it's difficult to afford air conditioning or to upgrade the energy efficiency of your home. But members also told us that it means that people have less places to shelter because the cinema can be expensive and shopping centres mean buying food and drink throughout the day or spending money on activities for the kids to keep them entertained. It also means that owning a car might not be an option. So on hot days, you're either trapped at home or you're exposed to the heat on the walk to the nearest train station. Another good example too is age, because it's already well known that young children and older people are more sensitive to heat. But then our members told us that children and older people also spend a lot more time in hot environments. That's because schools and aged care homes might have poor insulation and no air conditioning. And furthermore, organisations said that young people and older people are also less likely to have a driver's license or access to a car. So yet again, they're stuck at home on hot days or forced to use public transport. Breaking down these vulnerabilities meant that we could design solutions that addressed each individual element rather than having to approach vulnerability, such a big problem as a whole. And lastly, to finish off the last section of the report, the policy recommendations, they were general and can apply to any city, state or territory. But it should be said that we're really lucky in Victoria because many of the solutions we proposed are already underway. That includes retrofitting public housing with energy efficient upgrades, providing discounts to low-income households for a reverse cycle air conditioner, and many other things that were announced in last year's state budget. In terms of gaps in Victoria, though, there are 3 things I'd like to quickly cover here. The first is introducing a new minimum standard in rental properties that requires landlords to install an efficient air conditioner. Heating is a new standard that's just been added, but I'd love to see this extended to cooling, especially when you can get reverse cycle systems that do both. We also heard a lot from our members about the medical cooling concession in Victoria. It's an extra discount on energy bills in summer for people who have a medical condition that disrupts the way their body handles the heat. It's a fantastic initiative, but the eligibility criteria could be expanded to include older people and people on low incomes who can't afford air conditioning. And lastly, I think it'd be great to see a formal network of heat refuges across the state. Often shelters are ad hoc, like libraries or shopping centres. They can have quite reduced and restrictive opening hours, but I think a formal system would let every Victorian know that there's a public place nearby when they can keep cool. There also might be a role for the community sector to be funded to operate these shelters and provide extra services in tandem. I could probably go on and on about extreme heat after the research we did, but I think it's probably time to pass on to someone else. For that, Emma will be joined by 3 community health organisations who are addressing extreme heat in their communities through a project called Hotspots, which is funded by the Lord Mayor's Charitable Foundation. As Emma mentioned, these organisations are CoHealth in inner city public housing, Enliven in Dandenong, and IPC Health in Brimbank. But first, we're going to show you one of the interviews we filmed with a public housing resident who told us what heat waves are like in a high-rise tower.
My name is Erica. I arrived in Australia in 1978, and I've been here coming up to 16 years in September. One word: shit, it's hot. I mean, 27 and 26 was hot enough for the majority of New Zealanders. Coming to Australia, you felt the heat. I don't mind spring. I don't mind winter. Summer brings nothing but restlessness. You've got a lot of people who do suffer with heat strokes within their own home. A lot of people don't like to tell you how hard they're doing it. I suffer with the heat. The high-rise that I'm living in is concrete, and it retains its heat for a long period of time. While it was 30 outside, during the daytime it was 35. These high-rises were built in the 60s, but they didn't suffer the heat in those years. As we came towards the 70s and 80s, the heat increased. And it didn't last for a day or two. Sometimes it lasted longer. I had a fan, and trying to keep cool was impossible for me. Cold showers was the next best agenda. Got the 1 litre ice cream containers and filled it with water and had ice blocks, and had the fan blowing on the ice blocks, so that kept the room a little bit cooler. And then towards the end I started getting a tea towel, wetting it and freezing it, and putting that around me, just staying in the shopping centre, just to stay cool. And I spent the whole day there. It would be nice if they had that throughout all high rises, you know, aircon on each floor, you know, each hallway. To be quite truthful, a lot of people don't want to spend money to make it more comfortable living for, you know, new residents or old residents. No one wants to go out of their way to say, oh, we made them comfortable as best we can. And then when I got my aircon, it was really great, you know, kept the whole place nice and cool. Fan, aircon. I'm comfortable. But no one told me the electricity bill would be high. My electricity bill was astronomical. You know, so that's one of the things. Damn if you do and damn if you don't. I bear it all, like most of my generation, you know, just go with the flow. You take each day as it comes.
For more interviews and research about extreme heat, visit the Victorian Council of Social Services website at vcos.org.au/extreme heat.
Thank you, Ben, and thank you very much, Erica, for telling your story as well. We really appreciate your generosity. It's now my pleasure to introduce the panel. So joining me today is Afina Kappa from CoHealth, Heather Lawson from Enliven, and Shauna Carlson from IPC Health. So these community health organisations are addressing the impacts of extreme heat in their community through a project called Hotspots. And I'd also like to acknowledge that Hotspots is very generously funded through the Lord Mayor's Charitable Foundation as well. So I'd like to give them a bit of a shout out at the beginning also. I might start with you, Afina. Do you want to start by, I want to sort of talk a little bit about what the Hotspots project is. So Afina, can you talk about what's happening at CoHealth in terms of the Hotspots project?
Yeah, sure. So 2019, we were approached by Lord Mayor's Charitable Foundation to help them get some information, just reach out to our clientele. So I work with people over 55 who live in the high-rise buildings in Kensington, North Melbourne and Carlton. And so what I did was we created this survey that was based around storytelling. So we were able to, really sit down and ask the residents questions about how they feel during extreme heat events while living in the high-rise building. And we found the overwhelming feeling was just nobody cares about them, everybody knows that, obviously living in a government housing is not great, but what's the point in telling anyone about it? They just felt really hopeless. There was just an overwhelming feeling of hopelessness. So we were able to uncover just a lot. The people living there, the older people living there, were just feeling really helpless and just, like nobody really cares. So that was unfortunate to
fantastic. Well, not fantastic. It's actually terrible just way to describe it, but it'd be good to kind of dig into that a little bit further about some of the stories that you heard in a moment as well. And I might move to you, Heather, and ask would you mind telling us a little bit about how the Hotspots project played out with your organisation and your community?
Thanks, Emma. Yeah, in the summer of 2018-19, we worked with Greater Dandenong Council and the Royal District Nursing, now called Bolton Clark, and Southern Migrant and Refugee Centre in the Dandenong area, because that had been identified through increases at ED departments and also for ambulance call-outs for heat-related illnesses during heatwave periods. And so we worked a lot with refugees and migrants and their families, and particularly, as Ben noted, older people and families with young children are very vulnerable to heat. And we worked with them to really raise their awareness of the health risks of heat waves, because a lot of them hadn't experienced heat like we have it here in Australia. They may have come from hot countries, but it's different in Australia. And also the way that we, the context and the way we work is different. So for them, it was a matter of really letting them have the information so that they could change their behaviour and really modify the risk and reduce the risk, hopefully. And we know that, a lot of the people in that age group, in the older age group, have pre-existing health conditions. And they, like Ben said, from the research, they're much more vulnerable to heat. And I suppose the group that we worked with, they're more exposed to heat because of their housing, which is not always thermally comfortable, as we've known. And they have a sensitivity to heat because of their health conditions. And also they have a limited ability to adapt to it because of their limited financial resources. So it's really a group that are very vulnerable to the health risks of heat waves. And we really work to try and assist them to understand how they could modify their behaviour and stay safe during the heat.
Fantastic, thank you. And I might come back after we've heard from Shauna as well to also touch base with each of you around, what some of those modifications might have looked like. But before I do that, Shauna, would you mind talking to us a little bit about what Hotspots has meant for your local community? Thank you.
Thank you. Yeah, definitely. So similar to CoHealth and Enliven, our Hotspots Brim Banks project started at very close to the end of summer 2018, so going into that 2019 period. And that was in response to Brimbank being identified as one of those hotspots where community members are particularly vulnerable to the effects of heat for a number of reasons. And so since we've started this project, we've kind of refined our focus, and we're looking at 3 key areas across raising awareness, building capacity, and supporting community-led initiatives. So a lot of the work that we're doing is in partnership with council and other organisations, and we're really trying to look at who is most vulnerable, why that is, and what some of the solutions are that we can be working towards to help support community when we're experiencing extreme heat situations.
Thanks, Shauna. That's fantastic. And I think the common theme amongst each of you is that it's that really listening to community's voice and listening to the impacts for people, and some of the themes are similar. I think one of the really interesting things is, as you've each mentioned, you know, working with people who are generally they're in hotspots on lower incomes, but also needing to adapt. You know, what does that mean in terms of being able to cool your home? And I'm interested in terms of how people actually manage to keep cool, particularly if they've got pre-existing health conditions, etc. So I might kind of open it up to each of you. We'll see how this goes on Zoom. I might need to be a little bit more directive, so we'll see how the kind of flow goes. But did you see any particular strategies at work? Because I think, as we heard from Erica in the clip, one of the hard things is, even if you get an air conditioner, one of the things we know is people are reluctant to turn it on because they're worried about the impact of the electricity bill, etc. as well. So keen to kind of see if you saw any particular initiatives that you thought were great or you'd like to see extended more broadly. So I'll open it up more broadly. And perhaps Heather, did you want to kick us off maybe?
Yeah, look, I think what Erica said is just so true. And there was a survey done by Sweltering Cities, and they said 79% of the people surveyed had an aircon, but 73% of them said they were very scared about using it because of the cost. And 46% said they wouldn't use it because of the cost. So it's all very well to have an aircon, but you have to be able to pay for it. And that's an area where, you know, the concessions would be very helpful for people. But Erica's ideas, you know, of the ice in front of the fan, those sort of things, they were frequently talked about by people we spoke with. Going to the cinema, but there's a cost involved, going to the shopping centre, going to the pool. I mean, if councils can give vouchers out to go to the pool so families can go during the day. And libraries, we're finding more libraries are becoming open for longer hours during the hot days. So that's a great venue for people to go to without having to spend money, because most of these people don't have the money. But it's also getting there. You've got to have transport to get there. And if community transport can be brought into place to help people get to these facilities, it'll be really great to see. A lot of people have all the old-fashioned ideas, you know, under the cold shower, putting their feet in a bucket of water, cold water, and the kids in a wading pool out the back, and under the hose things. But it's really when it's going on and on for days on end, and we know that by 2050 we could have double the number of days over 35 degrees. So it's going to really impact on a lot of people if we don't take steps now.
Yeah, that's exactly right. And we hear lots of stories as well of people, for example, sleeping outside because they just can't stay inside because it's so hot, don't we? Like, it's horrendous. Yeah.
Yes. Yeah, that's right.
Afina and Shauna, did you want to sort of throw in any particular things that you've seen in with the communities that you're working with as well? I guess particular issues and particular things that maybe you've kind of seen work, because one of the things that strikes me around looking at heat waves across the whole of Victoria, and they impact on every community, but it's the fact that we don't have kind of one broader government approach. So it's that kind of often local councils might do some fantastic things, but they're not implemented equally across the state. Keen to know, maybe Afina and Shauna, if you want to start off by saying, you know, there's particular things that you've seen that worked and worked really well that you'd sort of like to see more of or make sure people are aware of.
I'll go first. So I guess my cohort, they're living in government housing. So to be honest, there's not really a lot they've been offered unless they've got a serious medical issue. The housing don't won't help with, cost of aircon, with installation of the air holes to put an aircon in. I did see a lot of the residents, though, they were really creative. A lot of them were putting foil on their windows, and some were using the foam from eskies and stuff to put up on the window. So, a lot of them also knew to go out in the morning, do all their shopping, they were really prepared. So that was really great. But yeah, in terms of your question, there wasn't a lot. There were also, especially in Carlton, the residents there, they would go to the Royal Children's Hospital. They'd go down to a lot of the local hospitals around there and just hang out there all day. So.
Yeah. Thanks, Athena. It shows that desperation, doesn't it, in terms of finding somewhere that's actually cool that you can go to.
Absolutely. Yeah. And these residents also, the buildings, they're not, they don't have much ventilation. They don't have any, they're concrete ovens, basically. The windows only open 12 centimetres in all of the high-rise buildings across Melbourne, so there's no airflow going through. So it's a big issue.
Yeah, it is. It's a huge issue, as you say, particularly when you're looking at high-rise estates as well. Shauna, did you want to touch on that as well, in terms of particular things that you're seeing, I guess, particular issues that emerge, but also maybe whether, again, if local council's doing something, that's great, that's good to call out. I know some local councils, for example, make the pool free for summer or on hot days, those sorts of things. So I'm curious for your observations.
Yeah, thanks, Emma. I think where we see quite similar issues in terms of ways to keep cool, I think one thing I would add is that we've seen discussions around strategies for keeping the house cool, so looking at keeping doors and blinds closed. But as we've mentioned, it's not exactly helpful when heat waves last for more than a couple of days and the heat inside just really builds up. Our council at the moment are looking at ways that they can use their resources to kind of open up cool spaces to community. So looking at that idea of cool refuges during summer, and I think that is really exciting to see. It would be great to see kind of a broader approach to helping community to prepare. But I think as well, in doing that, it also needs to be localised and consider local issues, as well as engaging with community and looking at how we can be supporting community to kind of lead their own solutions that will be relevant and effective in that space.
Thanks, Shauna. And I think that that place-based solution is so important, isn't it? It's one of the things around, I always look at sort of having that overarching framework, but actually being very particular about being local to local environment. Are there particular key things that, if you had your wish list and you could have your top 5, what would you choose, Shauna? Sorry to put you on the spot a bit.
That is a great question. I think definitely cool refuges, that would be a really big one. But then also within that, looking at those issues of access and making sure that they're inclusive and welcoming, and all of the other layers that would go into that. I think another one might be around, definitely we've seen a big theme around people not being able to use air conditioners, and that layer of cost which prevents keeping cool. So something around, I think the heater energy.
Yep.
Sorry,
the replacement program. No, it's great seeing that coming for heaters, but also the fact, as Ben mentioned, we'd really like to see that come in for aircon as well.
Yeah, absolutely. I think that would be amazing, particularly in rentals where there's like that added kind of difficulty around housing security and not being able to do as much in terms of retrofitting. So I think that would be another great, that would be on my wish list as well.
Yeah, definitely. And Heather, did you want to jump in there? Because you mentioned things as well like transport before, which is so important, because it's all fine sometimes to say we do see some brilliant practices, such as, as you say, libraries being open till later at night, or, I know people often will stay in shopping centres and those sorts of things as well, but then there's that hard part if you can't get there, and also the fact you've still got to go home at some point and you've still got to sleep in this, as you described, this oven, Athena. It's pretty challenging, isn't it?
Look,
Heather, did you want to
I
kind of
think,
touch on that a bit more? Yeah.
yes, look, I just think that the having community venues that are open longer and are cool spaces would be really good, but also councils looking at having the way to get there a cool area so that there are trees and things along the path to get to the venue. And if there isn't, then having some form of transport so people can get there without getting heat exhaustion on the way to the place. And just encouraging simple things like drinking tap water, like our tap water is safe to drink. You don't have to buy water. So really encouraging that, because people do forget, and that's the most important thing you can do to keep safe in the heat. And also providing those energy concessions and information about them, because not everyone knows about the concessions you can get for your energy, and assisting people in their negotiations with their energy companies so they make sure they're on the most, cost-effective plan, because that's something that can really assist people. But I think that it'd be good, like, if councils were able to give vouchers for swimming pools so the kids can go and enjoy the day there and cool off into the evening. That would be really good. And just encouraging people to really lobby to try and get insulation in their homes, because if you've got insulation, you're going to reduce the cost of your energy consumption. And that's something that I think we all need to look at, everybody.
Absolutely. Thanks, Heather. Athena, did you want to jump in with anything as well?
Yeah, I think some of the ideas that we've come up with, the residents have come up with ceiling fans and, solar panels. Solar panels is, I think is a great idea. And also like those gardens that they put on the top of buildings in the city and stuff like that, so they can have the shrubbery hanging over the windows to give them a little bit of protection from the sun in winter, and just those sorts of things would be really nice. And they're not that expensive. I mean,
Yep. Yeah, thank you. I know. I remember looking at the back of my energy bill, and it kind of had this description about how I could reduce my costs, and it was around the things like, you plant your garden and do all these things. You're thinking that's great, but if you're in a high-rise tower, that's pretty hard. Yeah. And also, if you don't have any money, that's a bit of a challenge at the same time. So it's all like, they're all things that we know are logical, but it also goes back to that point I think that you made, Heather, as well, around things like knowing that it's safe to drink the tap water and you don't have to buy it, and a whole lot of other things that I know community health does such an incredible job around, generally, genuinely working alongside the community, and listening to the three of you and describing the work that each of your organisations are undertaking, and truly hearing from local community and local voice, working to share information out, but also that listening component around also learning from people in the community as well. I'm curious as an extension of that, because I know that you all do incredible work with your local communities. And I think one of the things, and we've seen this shine through during the pandemic actually, is people know, trust and love their local community health organisation. It's where they go for information. And Athena, I'm thinking, for example, on the housing estates that you're talking about, I believe that 50% of the people who live on the estate, were already, they already went to CoHealth proactively for health advice because they knew and trusted the local community. And I know CoHealth played an incredible role there. I'm really interested in the advice you've got for other community organisations as well. And I know that you probably work with quite a lot of them already. But in terms of other community organisations who want to address extreme heat and also working in the same communities as you, really keen for any advice that you've got, because you've all done really specific work through the hotspots projects in terms of getting to know your communities. And I guess any wisdom you've got to share with other community sector organisations would be fantastic. So I might start with you, Athena, if that's okay.
Yeah, I mean, I guess because I'm talking directly with the residents, I'm right down there at the bottom with them, so I would say start with them, start with the people that work down there and get advice from them. Yeah, that's all I can think of, to be honest. That's where you'll really get all the good answers, you know, the real nitty-gritty.
Yes. I know I was at North Richmond last week or the week before. It's funny, the days seem to have merged in more recent lockdown times, and I saw the marquees out the front with local residents in, you know, answering questions, etc., that people had around different things that are happening. And it's that part about having a very strong local presence as well, isn't it?
Yeah, absolutely.
And it was people from the local estate involved. Yeah.
Yeah. Yeah.
Shauna, did you, or Heather, actually, sorry, I think I just cut you off, so jump in.
No, that's all right. Look, I think the most important thing is to talk with your clients, your members, your local community, to see what's impacting for them and what's important for them, and also engage with bicultural workers, because they have got the link into the community, and the faith leaders, to get the message out, because we know that, you know, through COVID, a simple message repeated often by trusted partners is the way to get people to understand what's going on and how they can help themselves, because people are very resilient, and if they've got the information, they can work out what's going to be best for them. They know their situation. So I think for any other community orgs that are looking at this sort of thing, start there. That's the point of, you know, really where you have to begin.
Thanks, Heather. Shauna, is there anything that you would like to add to that as well?
Yeah, I think just a really good point, touching on what Heather made, was to just get started. I think there's a lot of resources out there. I know that Enliven and Jesuit Social Services, for example, have resources to support organisations who are interested in heat health preparedness. And, you know, simple things like maybe signing up to heatwave alerts, or just learning about how heat affects the local community. I think looking at how a plan could be put in place could be really useful as well. So if, in terms of service delivery, looking at ways that, you know, maybe if you're calling up a client to reschedule an appointment, having some sort of a plan for checking in with clients and making sure that they're okay during summer, seeing if you can link them in with other resources, or just really just opening up that conversation. And I know it's really difficult to start thinking about that during winter, but at the same time, it can be a really great time to start to plan and really be prepared before we do come into those warmer months.
Thanks, Shauna. And I think that's an excellent point around, because I know when we talked about the launch of this report, we said, oh, it feels a bit strange. You know, it's the 3rd of June and we're now hit winter and we're launching our extreme heat report, or our, you know, but it is that point around, actually, if we're planning for summer, which will be here before we know it, actually doing that planning and preparation now. So in many ways, it's a good time to be launching this report, because we really want to make sure that we're thinking about these things now. And you've all been doing very specific work in that area, but not everyone has. And as we know, so many community sector organisations run on the smell of an oily rag. They don't necessarily have control over their own environment either. And we hear that a lot from those who run and work in community sector organisations around, you know, they don't necessarily own their own premises. They don't have the money to often think about what does heat mean even for themselves and their workers. And one of the other things is we see, and you would have each seen this, is that often when those heat waves hit, as in other disasters, they impact the people who work in the service themselves as well, you know, and which impacts on the delivery of services. Kind of curious for any sort of tips you've got there as well, or anything that you've seen work particularly well in your own organisations that you think would be good to share.
I think it's been interesting working with organisations. They sort of have an aha moment. They think, oh, yes, this does impact us, not just our clients, it impacts our staff as well. Sometimes staff can't get to work because public transport isn't operating, or they've got issues at home with their family that they need to care for because of health-related issues. So it really, I think it's through all the projects that have been run and the workshops that have been run by JSS and NAGA and so on, community services are becoming a lot more aware of how heat does impact both their clients and their own operations, and they're starting to plan a bit better for it now. And that's been really pleasing to see. And I think Shauna mentioned we've developed an audit tool, which just helps agencies think about, well, have we prepared in this area, and what do we need to do? Are we halfway there, or we haven't even started in that process? And I think that really it just highlights the work that needs to be done by organisations. But as you say, Emma, they're all running on the smell of an oily rag, and it is very challenging to add another thing on top of what they're doing, and particularly those that are also working in bushfire prone areas. You know, that's just another issue that they have to deal with. Yeah. So it is a challenge for community orgs to, you know, really do this work.
It's a great point that you just made, Heather, as well, about the audit tool, and often the things that already exist that others can borrow from. Because I think one thing the community sector is very good at is working as an ecosystem and looking at what is there that we can share. But sometimes the other thing we'll hear from people is, look, we didn't know that existed. So we're always keen at VCOSS to kind of be sort of a central repository for any information, etc. But could you talk more about that audit tool, I guess, and anything that you think of that you might be able to share or could be of value to other community sector orgs as well?
Yeah, look, as part of the NAGA workshops, we did adapt it and update it because it was originally done in 2013, and Enliven were involved with the original audit tool. But we're very willing to share it, and it's open for everybody to look at and really use as part of their work with their boards and their management groups. And the other thing that Enliven have been involved with, and this was a while back too, was developing a book with CSIRO. And that's got a lot of information for community service organisations to assist them. It looks at a range of areas that are useful, and that's available on our Enliven website. So I think to order. So, you know, we Enliven are very happy to share any resources that we've developed.
Thanks, Heather. That's fantastic. And it's also great, I think, for people to know they can jump on the website. And I guess talking of which, because I know that you're each doing things, Athena, is there anything in particular that sort of CoHealth has available that you'd really encourage other organisations to have a look at?
No, I think Heather, we get together a lot and we talk about, like I know I've spoken to Brimbank Council about all these alerts that you get, and you know we definitely share a lot of information. I think everybody's aware of what we do. It's all on the website, and yeah.
That's fantastic. Thanks, Athena. Was there anything else that you wanted to add in, Sean, or particular things that you've got that people might be able to access or make use of, or is it more you think is sort of looking at the joint resources that have been developed?
Yeah, I don't think I have anything at the moment to plug, but I think looking at, there are some really great resources. And again, like we work in partnership, and I think that collaborative approach is really quite a strength of the work that's happening across all of Victoria. So yeah, I guess connecting in with that in any way would be great.
No, I think that's great. And it also points to, it's that real value in collaboration, isn't it? And it's about having that time and space created to enable a collaboration, because when you look at the work on the ground that each of you have done with your local communities, and we talked earlier about that importance of place-based, but being able to bring that experience together to say, well, what might that mean for some tools that can actually be taken, such as an auditing tool, but applied at a local level. So it's a really fantastic outcome. I guess in terms of looking at, be it kind of sort of next steps or, you know, projects as well, I'm really keen to sort of talk a little bit about to hear from each of you about what your future plans are in terms of hotspots, etc. And I might start with you this time, Shauna, if that's okay. If you could just touch on what your future plans are, or sort of hopes for the future as well.
Yeah, definitely. So one of the things that we are really looking forward to working on is establishing a sustainable model of governance. So this would be looking particularly in the Brimbank area around a way to embed health work in council and with other community organisations. So I guess it's taking that next step in collaborative work and trying to increase our reach to community, but also to build our own capacity to support actions in that space. Another thing that we're looking at doing next summer is launching a youth-led social media campaign. So that has been designed throughout this past summer. and we're really excited to be sharing that around. And I think that'll be, yeah, really great to see work that was created with young people of Brimbank and really looking at that kind of co-designed messaging around heat health and really advocating for that next summer. So that's something that's really exciting.
That's fantastic. Thank you. Heather, did you want to jump in next?
Yes, we've been fortunate in getting some additional DELP funding to expand the Hotspots Dandenong project into the neighbouring municipalities of both Casey and Cardinia. And we've purchased some heat sensing cameras that are used by the local councils and community to identify areas where, you know, just to show the real evidence of what the difference is made by vegetation and different surfaces such as bitumen or grass. And that's been, you know, quite illuminating for people. And also we're working with partners, Jesuit Social Services, VCOSS, and NAGA in co-designing some climate change adaptation messaging with community leaders using plain language. And we're going to develop a storyboard picture book with children's illustrations to provide cross-generational approach with parents and grandparents getting the message through with children from all different communities. And also another project that we're working on is a research and evaluation project of knowledge and awareness of climate change and linking it to health amongst Southeast communities, and then the barriers and facilitators to action. So all developing that evidence base to support our work. But I think the community, the place-based approach is so important in this work. It's really, you know, the local community knows where the cool spots are, they know where to go, and they know, you know, how to look after themselves, and really working with both community leaders, bicultural workers and the faith-based leaders as well.
Fantastic, Heather. That's an incredible overview and very exciting work to look forward to, I think, as well as you say, in terms of building that evidence base that we can all learn from as well, and that really helps inform where future funding, etc., should go. Afina, did you have particular things that CoHealth is kind of hoping for in terms of looking at next steps in terms of the Hotspots project?
Yeah, so I was really lucky. CoHealth have given me this as my portfolio. So I was able to get a couple of residents from all the high-rise buildings that we support, and I've got a little residents group that we're going to get together once every few months and, you know, just talk about the issues, any other things that they might be able to think of that we could put to council, or, you know, I've got Sweltering Cities and also the Department of Environment Land. So I'm just in talks with all these other people and energy companies as well. And just keeping the residents on board with all of that information, you know, just trying to keep it at the forefront of everyone's mind, just advocating for the residents as well. So yeah, that's what's happening down at the high rises.
Fantastic. And I might just ask each of you, I know we're coming towards the very end of the panel session here as well. Is there anything that you wanted to briefly mention that I haven't asked you about? Because it's always tricky. You've kind of got a burning thing that you wanted to mention and you haven't had the opportunity. So I might just open it to each of you if there's any kind of particular thing that you wanted to flag before we bring the panel session to a close.
Look, I just say one of the great things this year has been the inclusion of climate change in the municipal public health and wellbeing plans, because it's really put it on the agenda of every council across Victoria, and that's been a real, you know, wake-up call for the 79 councils. So it's been great to have that there.
Yeah, I agree with Heather.
Fantastic. Well, a huge thank you to Afina, Heather and Shauna. It's been my absolute privilege to meet you, albeit via Zoom. I know we would love to have done this in person in an ideal world, but given the circumstances we're in, it's just been fantastic to have the opportunity to talk to you and hear the work that you are doing and the incredible work that you've all emphasised place-based. You've all emphasised that importance of listening to and hearing from your community and really letting them lead the work, but also looking at how you share information and that evidence building in terms of looking at what's possible in terms of next steps and in informing, I guess, future investment, but actually the well-being for every single person in Victoria, but also every single Victorian community. So it's pretty phenomenal, and I really appreciate you taking the time to share that with everyone who's on this call today. And I know we'll look forward to working with you more in future. We'd love to see it as well as these sort of hotspots programs evolve and looking at what the next steps are from here. So it would be fantastic to stay in touch with each of you. We look forward to working with you, and a huge thank you to all of you for being part of today. It's really generous of you. So thank you so much. We'll now move to the next video, our second video, this time with a young person from Western Melbourne, and the video will be followed by a quick 5-minute break so you've got the opportunity to stretch your legs. Thank you.
My name is Paminda. I was born in India and I grew up in Sunshine, West Side. It's really hard to explain, but in India, when you go, it's a different kind of heat. You definitely feel that it's hot, but it's not unbearable. But then coming here in Australia, like Melbourne weather is just like known for being like 7 seasons in one. Your body gets cold, but then for like a week or so, it'll like have to adjust again. It's really hard to shelter yourself from the world when you don't have, like, I guess the resources, and like everybody's just trying to survive as well as they can. And I definitely know when we were growing up, like in that dingy house in Sunshine, like we were doing the best we could to survive. There's only so much you can do, and when you don't have the money, I think we did have air cons in the house, but they didn't work and we couldn't get them fixed. And so it got really claustrophobic. And so especially in heat waves, you just feel like the walls are closing in on you. It was actually hotter in our apartment with fans on than it was outside. So sometimes the best thing that we could have do is just like get old bed sheets and put them in water and then go outside and you make your own air conditioner. Even like dipping shirts into water and then putting them on straight away and then going straight outside, and then just feeling like these really short moments of like coldness in the heat. And then even with our pillowcases, like my mum would get wet towels and she'd put wet towels over our pillowcases. And I think everybody's sort of related to a moment where they turned the pillowcase over to get to the cool side. And so that was definitely like a mwah moment. The places that I was able to sort of escape to were things like libraries. Libraries are so great. And I think I was really lucky to be able to escape to something. You know, going to a library, it's air conditioned, so you get air conditioned from the heat, but also libraries also have a lot of community, and also books are really great, and they did foster like a love for poetry for me, which is really great. So I guess going into a space that helps you survive but also thrive is really beautiful, and I think libraries really did that for me. I guess money doesn't fix all problems, but it definitely does shelter you from a lot of problems, and it definitely does help you survive, and it helps your fundamental needs be met. Heat waves are just really dreaded in my house. So, like...
For more interviews and research about extreme heat, visit the Victorian Council of Social Services website at vcos.org.au/extreme heat.
Thank you so much. I hope you enjoyed a good stretch break there as well. It's now my pleasure to introduce Adeline Stewart-Watt and Jackie Thurgood from the Department of Environment, Land, Water and Planning, or DELWP. Adeline and Jackie are members of DELWP's Climate Adaptation Team, which fund VCOSS's climate equity work, for which we're most appreciative. And it's just been fantastic. We're then going to hear from Christy Batcher from the Department of Health, and Christy helped develop the heat health plan for Victoria. So please join with me in welcoming Adeline, Jackie, and then Christy shortly afterwards. Thank you.
Hi everybody, thanks for having us today. I found the sessions leading up to us to be so interesting, and my goodness, those short videos you've made are so powerful, so thank you. As was mentioned, I'm Jackie Thurgood. I'm from the Climate Policy Unit at the Department of Environment, Land, Water and Planning, and I'm joining you today from Wurundjeri country. Some of you may be aware that a couple of weeks ago marked the launch of Victoria's first climate change strategy. This strategy is Victoria's plan to help slow down the changes to our climate, but also to build Victoria's resilience to the impacts of climate change, including, as we all know, that of both a hotter climate and increase in extreme heat events. So today my colleague Adeline and I are going to walk through Victoria's climate change strategy and also a few other actions the Victorian government is taking on the path to climate resilience. Next slide, please. So let's start with the Victorian context for action. As we all know, Victoria's climate has changed. Since the Bureau started keeping records in 1910, Victoria's temperature has gone up by 1.2 degrees. Now, if global emissions continue to increase, so that's the business as usual path that we're on at the moment, in the future, Victoria may experience double the number of very hot days, as Heather mentioned earlier. So we know this from some very recent and substantial downscaled climate projections that CSIRO have put together for Victoria. So we've got projections down to a 5-kilometre grid area in Victoria. So for places like Mildura, for example, in the 2050s, where a very hot day in Mildura means 40 degrees, at the moment they're seeing about 8 of those days on average a year. On the current emissions trajectory, somewhere like Mildura can expect to see 16 days a year of 40 degrees. So as we all know, when your aim is to support community resilience, spike days are not usually the greatest danger. They often occur as a run, so a heat wave, and that has really significant impacts on vulnerable people and supporting infrastructure. So we know that strong global action now will help us to avoid the worst impacts of climate change. Next slide, please. So continuing on with the context for action, Victoria was one of the first jurisdictions in the world to legislate a net zero emissions target. So our Climate Change Act from 2017 legislated a target for net zero emissions in 2050. And it also established a comprehensive framework to meet that target. So we've got a 5-yearly cycle of action to keep us on track. But it also steps through to make sure that we are planning for and adapting to the impacts of climate change. So the Victorian government received independent expert advice on setting interim emissions reduction targets, and that was required under our Act. That panel, in 2019, it was led by Greg Combay, and they proposed emissions reduction targets of 32 to 39% by 2025 and 45 to 60% by 2030. So that's on the way to net zero by 2050. Next slide, please. So the biggest announcement that came out of our climate change strategy was that Victoria has some new interim emissions reduction targets. Our new targets are for 28 to 33% cut to our emissions by 2025 and a 45 to 50% reduction by 2030. As a bit of context, that 2030 target is roughly double the national target currently, but all other states and territories in Australia have set net zero by 2050 targets as well. So what we know in terms of our progress towards net zero is that by 2019, and that's the last year that we've got, the latest year we've got the official emissions data, we know that Victoria's already cut nearly a quarter of our emissions from the 2005 baseline. So we've made some really strong progress. So when we're setting these targets, under the Climate Change Act, we had to consider a whole lot of different factors in making sure that they're both ambitious but achievable. So obviously we considered the latest climate science and the need to reach our legislated target of net zero by 2050. I mentioned earlier also the independent expert panel provided us some really strong guidance on appropriate targets. But also, and particularly in the context of the last 12 months in the pandemic, we really had to factor in the economic and the social impacts of reducing emissions and our pathway to net zero. Next slide, please. So where do our emissions come from? So looking at this graph here, Victoria's greenhouse gas emissions are generated by a range of activities across our economy. Energy is by far our largest source of emissions, as you can see, but transport is the fastest growing source of emissions for Victoria. So we've got a range of opportunities to cut emissions, but also to deliver co-benefits as we transition to net zero and hopefully a climate resilient Victoria. So in terms of the co-benefits from the action we've already taken, so as I said earlier, we've already cut our emissions by nearly a quarter. We now have 30% of Australia's renewable energy jobs, and already nearly 300,000 households have saved an average of $110 a year through our Victorian Energy Upgrades program, and that's really significant for households. It's also striking when you look at this graph to see the green bit down the bottom. That's the impact of land use and forestry sector in absorbing our emissions. Trees in forests and plantations absorb our emissions as they grow, and that has quite a significant impact in Victoria. But as we also know, green space also mitigates the impact of extreme heat. Next slide, please. So to help Victoria meet its targets, the Victorian government prepared emissions reduction pledges for each sector, and this is something that under the law we'll do every 5 years. So in this slide here, I've just popped in some of the top ways we're hoping to meet our emissions reduction targets, and it's things like setting targets of 50% renewable electricity by 2030, a 50% target for all new light vehicle sales to be zero emissions vehicles by 2030. And we're going to cut organic waste going to landfill by half by 2030. We will cease native timber harvesting by 2030. We've already stopped old growth logging. And the Victorian government itself has made some really significant pledges to impact its own operations and show leadership. So things like will have government operations powered by 100% renewable electricity by 2025, so years. Next slide, please. So reflecting on today's topic, a number of actions under the climate change strategy will both cut emissions and also build resilience to extreme heat, particularly for low income and vulnerable households. So those actions include the introduction of minimum energy efficiency standards for rental homes that cover insulation, draft ceiling and hot water. So that builds off the new minimum standards mentioned by Ben earlier for heaters. So also an action is to upgrade the thermal performance of and also appliances in 35,000 existing social housing properties. Another action is we'll be supporting 250,000 low income and vulnerable households to replace inefficient and ineffective heaters with high efficiency reverse cycle air conditioners. We'll be constructing more than 12,000 low cost homes. All of them will meet the 7-star efficiency. Also, in terms of, Heather mentioned bushfire affected communities, we'll be running a pilot for up to 3 remote fire affected communities to trial microgrids and standalone power systems to both improve their resilience to bushfires, but also the energy reliability for these remote and vulnerable communities. We've done a lot of work with our colleagues, interjurisdictional colleagues, to make changes to the National Construction Code. So from next year, new homes will have to meet 7-star building standards. The climate change strategy will also enable and empower Victorian communities to cut emissions and strengthen their resilience to climate change through a grants program, the Community Climate Change and Energy Action Program, providing grants of up to $75,000. We have the Resource Smart Schools program, that's embedding sustainability across Victorian schools. But also there's a $9.2 million solar on public buildings program. So this is the libraries and the other public space that we were talking about earlier. Now, complementary to the strategy, I did want to draw your attention to, in line with Heather's suggestion earlier about the need for cooler, active and public transport, the government has also recently announced plans to plant 500,000 new trees in Melbourne's west, so building green canopies and creating cooler spaces. So that is surely also a welcome action. Now I'm going to hand over to Adeline now on the next slide, and she can expand a bit more about the climate resilience side of things.
Thanks very much, Jackie. So I'll just take you through some of the government's work on climate change adaptation, specifically related to the climate change strategy. So as Jackie mentioned, the climate change strategy also continues a path to climate resilience that was initiated by the Victorian Adaptation Plan in 2017. And as the videos that we watched today highlighted, we know that climate change impacts are increasing heat waves, and that's posing significant challenges for Victorians now and in the future. But something, so even if we reduced our emissions today, and the government is obviously doing a lot of work around this, the climate's going to continue to warm for decades. And this is due to some of the historical emissions that are already trapped in the atmosphere. So to ensure that we're prepared for the current and future impacts of climate change, the Victorian government is continuing to invest in and act on climate adaptation. And adaptation is basically about making changes to the way we work, build, live and play to ensure that we're safe and prepared for the climate change impacts. And importantly, because we know the earlier we take climate adaptation action, the more Victoria will benefit and the easier it will be to adapt to the more to the larger changes expected in the future. So in the climate change strategy, the Victorian government committed to 19 adaptation priorities over the next 5 years. And these priority areas focus actions in 3 different areas. So firstly, they aim to address current climate change impacts that are already severely affecting Victoria. They aim to reduce barriers to climate change adaptation planning and action. And finally, they aim to lay the foundations for more transformational adaptation. And these priorities include things like incorporating climate change adaptation into policies, services and infrastructure. And this includes considerations for the increasing intensity and frequency of heat waves in Victoria. Next slide, please. So the Climate Change Act also introduced a system-based planning for adaptation. And this is very similar to the sector-based emissions reduction planning that has already commenced and Jackie mentioned earlier. So as part of this systems-based approach, the government is developing 7 adaptation plans for different systems. And you can see the systems named up there, but these includes the Health and Human Services system and the Built Environment system, both of which we know play very significant roles in community health and wellbeing. So the Victorian government is preparing adaptation action plans every 5 years, and the first round will be due at the end of this year. The government also previously released pilot adaptation action plans for the Water and Health and Human Services system. And so the Health and Human Services Adaptation Action Plan will build upon and further work already undertaken in the pilot plan. And you can see that available on the DH website. We've also been partnering, as you know, with VCOSS to ensure that the needs of vulnerable communities are being considered in the preparation of these adaptation action plans. And public consultation on these plans is due to commence shortly on Engage Vic, and we're organising some complementary outreach for targeted stakeholder groups led across government. So once these plans are available on Engage Vic in the coming months, we would very much welcome your ideas and feedback on these plans. Next slide, please. So as Jackie and I have mentioned, Victoria's climate change strategy sets out an ambitious but achievable path to a net zero emissions and climate resilient future. But we know that there's still much more work ahead. And there's many opportunities moving forward to engage in this process, especially over the coming 12 months. So for example, there's adaptation action plans that I just discussed, but there's also things such as the Clean Economy Skills and Jobs Task Force, which is going to help ensure that government investment in skills and training reflects the needs of a clean economy. So like the Paris Agreement, Victoria's Climate Change Act aims to ratchet up action over time, as Jackie has alluded to, and this is mainly based around 5-year cycles. But over the coming years, some of the key things that we'll be working on is that each year we'll be releasing the annual Victorian Greenhouse Gas Emissions Report to track our emissions levels and explain the trends that we're seeing. By 2023, we'll be setting the emissions reduction target for 2035 based on independent expert advice, and there'll be opportunities to contribute to this process. By 2025, we'll be looking to develop we will have developed our next round of sector emissions reduction pledges for the period 2026 to 2030. And then finally, every 5 years, we'll be issuing our climate science reports to ensure that our decisions continue to be based on the best available scientific evidence. And you can see the climate science report for 2019 on our website as well. Next slide, please. So just to say that Victoria's climate change strategy is available on the Vic government website, and it's alongside other resources on climate change that might be of interest to you and your organisations, like, for example, the Climate Science Report. Thank you for the opportunity to present to you all today.
Good afternoon, everyone. My name is Christy Boucher, and I am a Senior Project Officer in the Emergency Management Branch at the Department of Health. How great was that panel discussion to hear about the local knowledge and initiatives. Local planning and response can have the greatest impact in protecting those most at risk. I've been asked to speak to you about the department, sorry. I've been asked to speak to you today about the department, what the department is doing to prepare and respond to extreme heat and heat waves, particularly in relation to those most at risk. Let's see. My colleagues at DELP have spoken to the climate projections identified in the climate science report. So you'll have seen this image. But I just want to highlight that the Victorian climate projections are broken out by regions, which may be useful in how we plan our cities and regional areas, how we build our homes and infrastructure, and how we as individuals prepare and adapt to a changing climate. The scenario projected in this image here could see some very significant health impacts. This slide from the World Health Organization shows a number of direct and indirect impacts of extreme heat and heat wave, which we heard about a little already today. Direct impacts can include heat-related illness, exacerbation of a pre-existing medical condition that may lead to hospitalization or in some cases may be fatal. And indirect impacts could include increased demand on Ambulance Victoria, which could impact response times, increased presentations to emergency departments and hospital admissions, an increase in accidents such as drownings, and an increase in other infections such as food and waterborne diseases due to poor food handling or storage during heat events. In major events, we may see a disruption to infrastructure such as power outages or public transport. And I'm sure we can all recall images of people sweltering on the platforms waiting for a train during the 2009 heat wave. Extreme heat can affect anyone, but some people are more at risk, which we have already discussed a little bit today. But it might be because of one or more of the following reasons. Age, for example, someone over 65 years. Health, someone with a pre-existing medical condition such as respiratory or cardiovascular disease, mental illness or limited mobility. Or it might be related to certain medications that may not be as effective in extreme heat, like anticonvulsants or antidepressants. Social and economic circumstances might relate to someone who might be sleeping rough, or someone who might not have access to air conditioning or even afford to service or run it. Or they may be socially isolated. Additionally, people from a culturally or linguistically diverse background may be at risk because they cannot access or understand the messages or warnings. The Department of Health's Heat Health Plan for Victoria is part of the State Extreme Heat Subplan of the State Emergency Management Plan. That's a lot of titles. It sets out what the department will do to prepare and respond to extreme heat. And it also provides information on what others, such as health services, community organizations, councils, and individuals can do to prepare and respond to extreme heat. Last year, the department released the addendum to the Heat Health Plan for Victoria, which highlighted further considerations for extreme heat in a COVID-19 environment. The restrictions may impact someone's ability to stay cool during a heat event. For example, a person may be confined to their home, leading to indoor overheating because they might test positive to coronavirus or are a close contact of someone who has. Or the risk of infection in the community is too great, so they stay at home as a means of protection. We also see more people working from home as well. Depending on the level of restrictions, those most at risk may not be able to access cool public spaces, such as swimming pools, libraries, and movie theaters, or the capacity of these spaces may be limited. In this instance, it is important for councils and other organizations to consider alternative arrangements, and messages may shift to how to keep cool at home and potentially without power. The addendum also provides planning principles and possible actions to assist organizations in their planning and response to extreme heat in a COVID-19 environment. The department's Heat Health Alert System provides an early notification of forecast extreme heat to subscribers. The department monitors the Bureau of Meteorology forecast daily maximum and minimum temperatures and calculates the daily average temperature for each weather district. The average temperature for any given day is the average of the forecasted daily maximum temperature and the forecasted overnight temperature, which is also the daily minimum for the following day. When forecast daily average temperatures are predicted to reach or exceed the heat health temperature threshold for any weather district, the Chief Health Officer issues a heat health alert for that district. The map on the right shows the heat health temperature thresholds by district. Heat health alerts are sent via email to over 7,000 unique subscribers. The subscription service is open to the public, so if you haven't already subscribed, I encourage you to do so. It is absolutely free. If we look at the 2021 summer, which was heavily influenced by La Nina, so fairly cool, the Chief Health Officer issued just 16 heat health alerts, accounting for 4 days of extreme heat. Which can unfortunately lead to a little bit of complacency in future summers. So we might have our work cut out for us this coming summer. Raising awareness about the risks of extreme heat and how to survive the heat is critical to behavior change. To support this, the department has developed a suite of communication resources. Pardon me. A suite of communication resources for the community, some of which have been translated into 22 community languages. The poster and brochure on the right provide practical heat health messages and tips to survive the heat, including ways to keep cool without power. The resources can be downloaded or ordered at no cost from our website. The department also offers resources for the sector to assist in raising awareness, identifying signs of heat-related illness, and planning for heat events. The supporting people by telephone script is particularly relevant in a coronavirus environment where more and more contact is done via telephone. The script helps the caller walk through steps with the person on the other end to identify if they are suffering from heat-related illness. The Survive the Heat campaign is a multifaceted approach to raise awareness about the risks of extreme heat and how to survive heat events through radio and online channels. The prepare and always on messaging remains active from about the 1st of December until the end of March to keep heat risk at the forefront of the community during summer. During prolonged heat events, emergency advertising will enhance the messaging and hopefully reach to protect those most at risk. To reach those from culturally and linguistically diverse backgrounds, emergency advertising uses cold radio and Facebook messaging in 8 community languages. But we want to ensure consistent community heat health messages are spread far and wide, reaching those most at risk, their loved ones and their carers. To support this, the department has released a media toolkit with samples of newsletter articles, social media posts, tweets, and social media tiles. This is available at no cost, and I encourage you to check it out. If you would like more information, please check out any of our websites, the Department of Health's websites here, as well as DELP's website for climate projections. Thank you very much.
Hi everyone, and thank you so much for attending our webinar today. I'd just like to thank Adeline, Jackie and Christy for attending from DELP and Department of Health and presenting on what the government's been doing about extreme heat. And then also a big thanks to Athena, Heather and Shauna from community health organisations about some of the work that they've been doing. And thank you so much for attending. I know this past week has been a difficult time for a lot of us, and we hope that tomorrow would be getting out of lockdown. But I hope you and your family are able to stay safe in the week ahead. In the meantime, keep an eye on your inbox. We'll be sending out a link to the Feeling the Heat report and some of the other videos for you to watch. You can also go to vcoss.org.au/extreme heat, where you can find that report and the videos as well. You can also feel free to reach out to me or to VCOSS if you've got any questions about the information presented today. Before we go, we'll just play one more video. This time it's set in Mildura in northwest Victoria. And yeah, thank you very much for attending.
I'm Sarah. I'm from Mildura. I'm a single mom. I've lived in Mildura all my life and it's really hot. Gets to about 47 to 48. Depending what day it is. Inside the house, it could get over 50 because of the heat. With 3 kids under 3, with no aircon, is really hard. kind of just makes you not want to do anything, really. When you're hot and bothered, you can't be bothered really doing anything. But besides trying to get cool and keep cool. You don't get a lot of money off Centrelink. People think you do with 6 kids, but you don't. Because you've got to pay all your bills, have food, make sure your kids are clothed. So it's really expensive. And for a reverse cycle, I don't have that kind of cash to get one. So yeah, it's really expensive. What we used to do is use face washers, wet them and put them on our foreheads. I remember I used to put them on my arms even at times. Couldn't really do much besides do that. Even though I live on the Murray, that would be a nice place to keep cool, but I can't see through the water, so I don't. It's pretty hard with 3 kids to go to the pool, so especially with that age. We went to a beach one time. It's kind of scary taking kids to a beach, but another place I would escape to keep cool would be Centro, it was called at the time. It's like downtown, but inside, with lots of shopping centres and food. And you've got a car full of kids and your aircon's not working too good. It's very hot. So sometimes it was better just to have the windows down. We've got vents like throughout the car, but it's still hot. The kids will be dripping in sweat. So like, I don't even use mine, I like send it back to the kids kind of thing because it's hot. People have actually fainted just because of the hot heat. I remember my mum did once. This one day she had to get a taxi home for some reason. I couldn't remember what degrees it was, but I know it was in summer because it's still in February when I was nearly due to have my baby. Like she's pulled up in our driveway and she's collapsed. Like she was dripping in sweat and I've like ran over trying to catch her when I'm like pregnant, nearly due to have my baby. Too hot to walk, too hot to drive. Can't win.
For more interviews and research about extreme heat, visit the Victorian Council of Social Services website at vcos.org.au/extreme heat.